Hi friends, welcome to Happy Nursing. This is Ela. Today we will discuss about the 21 nursing problems given by Abdullah. In our last video, we discussed about the 10 steps to identify the patient's problem and 11 nursing skills to develop a treatment plan. Let's recapitulate once again. The steps to identify the patient's problem are: learn to know the patient, sort out relevant and significant data, make generalizations about available data in relation to similar nursing problems presented by other patients, identify the therapeutic plan, test generalizations with the patient and make additional generalizations, validate the patient's conclusions about his nursing problems, continue to observe and evaluate the patient over a period of time to identify any attitudes and clues affecting his or her behavior, explore the patient and his or her family's reactions to the therapeutic plan and involve them in the plan, identify how the nurses feel about the patient's nursing problems, discuss and develop a comprehensive nursing care plan. The nursing skills needed to develop a treatment plan according to Abdullah are: observation of health status, skills of communication, application of knowledge, teaching of patients and families, planning and organization of work, use of resource materials, use of personal resources, problem solving, direction of work to others, therapeutic uses of the self and nursing procedure. Now let's get on to the nursing problems given by Abdullah. They belong from the following aspects: physical, sociological and emotional needs of the patient, types of interpersonal relationships between the patient and nurse, and common elements of patient care. So the problems are as follows. First one is to maintain good hygiene and physical comfort. Hygiene is important, otherwise patient can get infected, and if patient is not physically comfortable, then he will always feel uneasy. Next is to promote optimal activity, exercise, rest and sleep. All these are our self-care components to maintain good health. Patients should be able to maintain an optimal level of health so that they can fulfill all these self-care demands. Next is to promote safety by preventing accidents, injuries or other trauma and preventing the spread of infection. In a hospital, there are several risks such as fall risk, risk of pulling out IV lines, Ryle's tube, sleeping in the washroom, etc. Again, patient is having risk of infection from the hospital staff's surroundings, invasive lines and procedures, etc. So patient should be protected from both. Next is to maintain good body mechanics and prevent and correct the deformity. Patient should be able to maintain a good posture. If there is any deformity like impaired posture or something like that, it should be corrected or prevented from further damage. Next is to facilitate the maintenance of a supply of oxygen to all body cells. Oxygenation is very important, very crucial actually, not only to the lungs but all parts of the body. Any body cells not getting oxygen will be cyanosed, dead, necrosed and ultimately damaged. Next is to facilitate the maintenance of nutrition for all body cells. Nutrients for all body cells should be available for the cell growth and cell cycle to continue. Next is to facilitate the maintenance of elimination. As I have said earlier also, elimination of wastes is very important because the wastes are not needed anymore in the body. So they are going to be toxic to the body if not excreted properly. Next is to facilitate the maintenance of fluid and electrolyte balance. Fluid level should be maintained, otherwise too less fluid can cause dehydration and too much fluid can cause fluid overload. Maintaining electrolyte levels like sodium, potassium, chloride, etc. are also needed very much, otherwise it can cause many systemic problems. To recognize the physiologic responses of the body to disease conditions, pathologic, physiologic and compensatory. Whenever we suffer from any disease, our body reacts to it in the form of symptoms. We should recognize those symptoms. For example, if a patient has a lung congestion, there will be respiratory distress. Now we cannot see the lung congestion from outside, but we can see the breathing trouble of patient, right? Even if he is not able to express that, we should look out for the signs like nasal flaring, difficulty speaking, gasping, breathing through mouth, etc. and recognize that patient is having respiratory distress. To facilitate the maintenance of regulatory mechanisms and functions, The regulatory mechanisms of our body are the hormonal secretion, temperature regulation, the thermoregulation, etc. We have to help a patient to maintain that. For example, if he is feeling cold, increasing the room temperature, checking fever and giving antipyretics, sponging, providing blanket, etc. To facilitate the maintenance of sensory function, we have to look whether the patient is able to use his senses properly or not. To identify and accept positive and negative expressions, feelings and reactions. Being admitted to a hospital or being sick for a long time, patients often harbor numerous positive and negative feelings in them. A nurse's job is to identify those. For example, a patient replies to the health teaching, "What's the need of teaching me all this? I won't live anyway." Then we have to identify that there is a hopelessness in the patient. To identify and accept interrelated emotions and organic illness. Sometimes our emotions are related to our illness. Nurses should identify that. To facilitate the maintenance of effective verbal and non-verbal communication. Nurses should see that the patient can communicate with the healthcare team members as well as others effectively, because knowing about the patient's problem depends on it. To promote the development of productive interpersonal relationships. Maintaining a good interpersonal relation with the nurses, doctors, other patients or family can keep the patient physically and mentally healthy. So, nurses should try to facilitate that. To facilitate progress towards achievement and personal spiritual goals. Patient's spiritual practices should be permitted and a sense of achievement should be instilled in the patient on the completion of each step of treatment, like completing a chemotherapy cycle. Next is to create or maintain a therapeutic environment. An environment which helps the patient to heal should be maintained. For example, an environment where there is noise, shouting, lack of proper lighting will automatically make the patient feel gloomy, even if you follow the therapeutic regimen properly. It's because patient's well-being depends greatly on the environment. Next is to facilitate awareness of self as an individual with varying physical, emotional and developmental needs. The patient should be aware of his appearance and his needs, and nurses should be the facilitator of that awareness. Sometimes patients are not aware of his own appearance. Even for sickness, he is not often careful about his own needs, like need for cleanliness, rest and sleep, etc. Nurse should be aware of that. Help the patient to maintain the same and also teach him to be alert of his own needs. Next is to accept the optimal possible goals in the light of limitations, physical and emotional. Patient will have certain goals in their mind, even with certain limitations, like one with hemiplegia likes to take a walk in the evening using a crutch. Nurse should accept that and help him to fulfill that. To use community resources as an aid in resolving problems that arise from an illness. Many problems can arise from an illness that a patient may face. We have to solve that using the resources available in hand. For example, patient may not be allowed to able to swallow tablets. Before going to any other option, we should use crusher to crush the tablet in powder form and see if he can swallow it. Before that, obviously, we must make sure whether the tablet should be crushed or not. To understand the role of social problems as influencing factors in the cause of illness. Social problems like broken home, domestic violence, etc. can cause psychological diseases. Not only psychological, many a times it happens that the patients come injured after domestic violence or abuse but cannot express it. Nurse should be alert enough and to identify and understand that. So that's all about Abdullah's 21 nursing problems. Summarizing them once again: to maintain good hygiene and physical comfort, to promote optimal activity, exercise, rest and sleep, to promote safety by preventing accidents, injuries or other trauma and preventing the spread of infection, to maintain good body mechanics and prevent and correct the deformity, to facilitate the maintenance of a supply of oxygen to all body cells, to facilitate the maintenance of nutrition for all body cells, to facilitate the maintenance of elimination, to recognize the physiologic responses of the body to disease conditions, pathologic, physiologic and compensatory, to facilitate the maintenance of regulatory mechanisms and function, to facilitate the maintenance of sensory function, to identify and accept positive and negative expressions, feelings and reactions, to identify and accept interrelatedness of emotions and organic illness, to facilitate the maintenance of effective verbal and nonverbal communication, to promote the development of productive interpersonal relationships, to facilitate progress towards achievement and personal spiritual goals, to create or maintain a therapeutic environment, to facilitate awareness of self as an individual with varying physical, emotional and developmental needs, to accept the optimum possible goals in the light of limitations, physical and emotional, to use community resources as an aid in resolving problems that arise from an illness, to understand the role of social problems as influencing factors in the cause of illness. I hope it's clear to you. If my video is useful to you, then please like and share the video and subscribe my channel. Meet you in the next video. Thank you for watching.